My name is Caroline Munyi, and I work for AkiDwA. I am the Migrant Women's Health Coordinator here in AkiDwA. And when I say AkiDwA, it stands for AkiDwA Africa, or Sisters from Africa. AkiDwA was started 20 years ago. Next year, AkiDwA will be 20 years old. And when AkiDwA was started was because there was a lot of exclusion of women. Women were feeling very, very isolated here in Ireland, especially women coming from the south, from the global south. And so the women would meet. I understand from those who are there, especially my boss, Salome, that they used to meet sometimes in the Gresham, sometimes somewhere near the post office, and then the women would always be talking about how isolated they were, and they truly looked isolated, and there were a lot of issues, and one of the issues was one of racism, among others, and also being misunderstood in health settings, in so many areas of their lives, and that posed a huge challenge for them. And when you look at it from the fact that they are so far away from their homes, from their nearest and dearest, and then being in an environment which is not familiar to them, weather, food, and everything. So AkiDwA has morphed now into this organization which looks after the needs of migrant women. The women know AkiDwA, AkiDwA knows the women. There was also the issue of female genital mutilation, which was affecting a lot of women who are the members, and that came up in one of those discussions, like when the women meet up. Sometimes I understand those days it used to be a hushed subject. They wouldn't talk about it like very loudly, but it was an issue among several women, and that is why my boss, she was like, what can we do about this issue? Nobody is talking about it here, but our women are talking about it, and it's affecting them. They are talking about how when they present, mostly in maternity hospitals, how the issue is misunderstood, and even how they feel not being able to engage or to explain what it is, yet it was, and it still is, a huge issue. So now, among other things, why AkiDwA was formed, that's just a small background, because I know that I'm aware that we are known for female genital mutilation a lot. My role in AkiDwA involves looking at the issues, especially health issues, which are affecting migrant women. We deal with some very sensitive and delicate issues which are affecting our members. And we find that sometimes there's lack of cultural understanding, especially on the area of communication, on how to ask delicate questions about sensitive issues. And sometimes a woman may feel that she's leaving an health establishment without engaging well with a health caregiver. So we like making sure that a woman is well attended to in a culturally appropriate way. The health issues which migrant women would face today, actually on top of the issue of female genital mutilation, which is a huge gynecological issue, and we are doing our best to make sure our women are well looked after here and understood, as well as making sure that girls at risk are not subjected to that practice. We also have other issues like mental health issues, which is a huge health issue in any population. And when it comes to migrants, the issue of mental health, it's not well amplified, yet we know it affects them a lot because of so many things. For example, when you look at going back to work or getting into jobs, even when a migrant woman here is well qualified, it's very, very difficult. So you can imagine how that affects somebody mentally, and even their capacity to integrate. And even, like when you wake up in the morning and you go somewhere and you work and you go back in the evening, there's that part of you, it feeds into your dignity, it feeds into your confidence. So you can imagine the level of erosion when it comes to confidence, which some sectors of the population, especially migrants, feel. because they cannot access the labor market. So that is one issue, the issue of labor or not being able to work. And then you can also see like how that ties again with mental health, and then how the issue of mental health services here, how they are not structured to look after migrant particular needs, and among other health issues. And again, even when you're talking about health issues, a person might be suffering or might be having a health problem, which other people have. But we also need to look at when this person goes to the health facility, how is this person viewed? How is how is the interview process? Maybe with a GP. If it's in a maternity setting, how is that? Does she feel that she's being treated well like everybody else? Our women sometimes will come here to us when they are being faced with homelessness. Some of them are also being faced with domestic violence. Some of them are also, sometimes it's domestic violence, homelessness, lack of food. Like that one person can come with such problems all at once. Others will come with threats. Maybe someone wants them to take their children back to Africa for FGM. So sometimes we have to do a lot of advocacy and behind the scene work for those members. And we also said word around that should they hear about anything which is happening in the community, even among themselves, to come to us. One thing which can be done, I know we've been talking a lot about what can be done at policy level. It's about, again, inclusiveness in want and deed, and even to make sure that maybe in the main sectors where migrants frequent, to ensure that there are people that were working, for example, who represent them, so that when a person goes there, they'll see someone who's, because that alone breaks a certain barrier. I can talk, I can ask questions, I can do this, because sometimes I think that would help, because we are conscious of the fact that a lot of services are concentrated in Dublin and have more offices maybe all over Ireland, so that you can be able to reach more women here and advocate for them in their local areas where they live. But services are not they're not there to cater for their needs. So we'd like to have their voice heard, and not just heard, but even to make sure that they'll see it in tangible ways, that things are happening to us, and that to us that would mean a lot, and you can see or can hear about the kind of impact our work makes on the ground among the people who are very, very vulnerable and who would have nowhere else to go, were it not for the fact that a small organization like AkiDwA is existing. So I want to say that living in deprivation centers, even in what we may call normal times or peacetime, I like calling it that, it's difficult. It's very, very tough, even before the coronavirus. And so you can imagine if it was so difficult for them during those days before the pandemic, then how tough is it for them at this time? For example, we've been interacting a lot with our members, or through the phone, on Zoom and other channels of communication. But one thing we realized is that we are not able to reach so many people, because most of our members do not have the necessary infrastructure. To have Zoom, you need internet. So they don't have maybe a smartphone. They don't have the internet where they are, even to tell us. So sometimes before you know what's happening, you're reading about what's happening to your members. You're seeing it in the news, like what was happening in Kerry, for example. We had our member there, but sometimes you see they don't have that. So there's so much which needs to be done, so that people living in deprivation can feel like human beings. I know we are talking about it being abolished, but we still can do something before it's abolished completely, to ensure that the people who are already there, those remnants who are there already, that they'll feel that they are living the life worth living, because it's quite inhuman. And as I've told you even before I go into the small details, if things were bad before, so just imagine now that you have a global pandemic which has caused mayhem to everyone. What's happening to who are already so vulnerable? For example, we heard that there was no social distancing, and that was very true. Women called, and they told us it's true. We are not socially distancing. Sometimes one of us maybe has, maybe some people got infected with the virus, and when they were discharged, even before the 14 days, they were with everybody else, eating in where they eat. No social distancing, no, sometimes even no hand sanitizers, no nothing for these people. So they were saying that they don't feel that they are being treated well, and that they felt exposed to the virus. And so like a lot needs to be done, because we have missed a lot of opportunities to help people who are vulnerable, and we wouldn't want history to judge us harshly because of some of those some of that bad treatment. One thing you can do, like, is to be open to learn. Like, sometimes you can say something which is very normal to one person, but when you say it to another person, that person will feel offended. So it's good to learn about some of those triggers which will make another person feel, oh no, that one has crossed the boundary. Even maybe maybe even during maybe a normal interview process in the doctor's office. For example, I said that a woman who has gone through FGM, she may not even, when she goes to the doctor, she will not even talk about it. Maybe until maybe she's being interviewed, maybe because she's pregnant, and then someone will see something which is unusual. So, like, how do you question such a woman about what has happened to her without hurting her even more? And again, remember, a woman might come to you, she has gone through FGM, but even she does not think it's something bad. So how do you, again, question her and also bring her to that? Okay, I'm not saying that a doctor is there to educate somebody about cultural violence, but how will we manage to move that woman to that place of this happens to you maybe because of this? You know, like this is as a consequence of what happened to you, without making her feel as if her culture is being attacked. That when you want to ask a delicate question, and maybe the issue of culture comes in, so how do you jump that in a safe way without making someone feel that where they come from has been undermined? Because I know bad things might have happened there which are not supposed to happen, but that place is still dear to those people, and even those people who did it, they're still very, very dear to that person. So there's so I think there's so much we can learn, not just about that issue, but even other issues which make up our daily interactions easier.